Lung cancer. It's the leading cause of cancer deaths for both men and women. And as we age, our risk increases. Still think only smokers need to worry? Think again. Dr. Debora Bruno is here with the latest information on diagnosis and treatment for lung cancer. Dr. Bruno is in the Cancer Care Center at MetroHealth. Welcome to the show.
Thank you, Laurie. Thank you for having me here.
So if you've never smoked, do you really have to worry about the symptoms of lung cancer?
Unfortunately, yes. Lung cancer still can happen in people who never smoked, including people who are exposed to what we call passive smoking, so just the smoke of cigarettes.
Just in the air. Just
in the air, they still can develop lung cancer. And, but for the most part, smokers are the ones who are at the greatest risk for developing the disease.
Okay.
Smokers do have more than 20 times the risk for developing lung cancer compared to non-smokers.
Wow.
In fact, more than 80% of the lung cancers are related to tobacco exposure. But the good news is that if you quit smoking, then your risks progressively decline, and more often so after 15 years of quitting smoking.
Well, there's hope then, right?
Absolutely.
So what are the symptoms of lung cancer?
So they can vary. Smokers usually cough, and if there is a change in the pattern of cough, more sputum production, or perhaps blood in the sputum, that may be a cause for concern. People who developed chest pains, and the chest pains just don't go away, or unexpected weight loss, symptoms such as bone pain, headaches, or increased difficulty breathing, they can all be signs of or symptoms of lung cancer. But the problem is sometimes when the symptoms develop, the cancer is far advanced and already has metastasized to other parts of the body.
Oh, that's a shame. So there really isn't a screening test, is there?
Well, there wasn't up until recently.
Oh, good.
Yes. So now we do have something that we call low-dose screening CT, which is a CAT scan that is offered and recommended for smokers or people who have quit smoking within the last 15 years, and that has been proven to decrease mortality rates by lung cancer by 20%. So
wow, that's good news there. But no matter when or how you detect it, you got to treat it. So are we talking chemo or radiation, or what is the treatment?
So it all depends on how far advanced the cancer is. If the cancer is still localized to the lungs, then often surgery is the best treatment. We sometimes follow surgery with chemotherapy in order to try and kill any potential cancer cells that may be left in the body. If the cancer is still confined to the chest but is no longer surgically resectable, we often combine chemotherapy and radiation in order to try and get rid of it. Sometimes if the cancer is still localized but the person cannot have surgery because doesn't have lung reserve to have part of the lung removed, then we can offer what we call radiosurgery, where we provide a very high dose of radiation just to the tumor and often completely kill the tumor that way.
Oh, that's good. But what if it has spread to other parts of the body?
Then the goals of the treatment become what we call palliation. So we try and shrink the tumor for as long as we can while providing the best possible quality of life for the person. This is often done with chemotherapy, but up until recently we started to develop new treatments. We have what we call targeted treatments that target specific genetic alterations that certain lung tumors have, and some patients are candidates for that. Those are usually pills, very well tolerated. And we also have what we call immunotherapies, medications that can help the immune system of the person actually fight the lung cancer, and those are not chemotherapy either. So we are having advances in the treatment, coming up with drugs that are better tolerated, highly effective, and the overall survival rates for lung cancer have improved over the past years.
Oh, that's really good to hear. We can breathe easy when we hear that advances are being made in the fight against the deadliest cancer, lung cancer. And we thank Dr. Bruno for sharing them with us today.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org. Next.